Thank you, residents, for joining us again for another virtual town hall. Today is Wednesday, April 8th. You may have already heard that yesterday, Tuesday, April 7th, we received our formal notice of a COVID-19 case right here in the village. While this is the first confirmed case, we do not believe it is the first infection in our community. This belief is based on reports of numerous individuals that have experienced symptoms over the past several weeks that have resembled COVID-19. We believe that we've had numerous infections, but due to the availability of testing, severity of symptoms, and the risk profile of the patients, these cases have not been tested nor confirmed. As of today, we're at 5,148 cases in Ohio, of which 21 cases are here in the county, 1 confirmed case right here in Yellow Springs, and 1 death in the county. As we stated before, we expect these cases to So as Dr. Acton has stated before, these cases will continue to increase from here. The model predictions have been right on so far, but there's still plenty that we can do to flatten out the curve, stretch out the curve. It is important that we act as if COVID-19 is widespread throughout our village, and we must behave as if we are all carriers, regardless of signs or symptoms. And we must do our part to protect our neighbors, our friends, and our families. So please, we encourage you to continue to practice the basic protective measures, which now include wearing face masks when out and about. Also, please stay home. And if you must go out for essential business, remember to take all protective precautions. Our thoughts are with all the residents in our community who are experiencing symptoms and have concerns for their safety and health. A reminder that the stay-home order is in effect through May 1st. Joining me tonight is Lisa Krieger, council member, Kristen Beam from Greene County Public Health, Fire Chief Colin Altman, Police Chief Brian Carlson, and Mayor Pam. And now I will pass the floor to Lisa Krieger. Lisa, thank you.
Thanks so much, Josue. I just wanted to acknowledge that tonight is the first night of Passover. And here in Yellow Springs and across the world, families are in lockdown, living in fear or grief, and coping with profound uncertainty about how long this plague will last. This is not a normal year, although some rabbis have noted that the very first Passover was also held during a lockdown. I only pray that this holiday finds you and your loved ones of all faiths in Yellow Springs, our township, Greene County, Ohio, our nation, and our planet safe and sound, sheltering in place, and that should you choose to observe it, the Passover themes of suffering and ultimate freedom can bring a little light to this darkest of springtime. We're fortunate to be able to hear the birds in our community sing outdoors so that others can hear you. Thank you.
Thank you so much, Lisa. And now we will hear from Colin Altman, Fire Chief. Colin?
Thank you, Josue. Miami Township Fire Chief Colin Altman, that's me, coming to you live from Roosevelt, New Jersey, in front of Congregation Anchi. This is the town I grew up in. And I'm wishing you all a joyous, happy, and kosher Passover. When I was a kid in New Jersey growing up, one of my fondest memories was going for Passover Seders to the city, to my grandparents' apartment. My brothers and I would all fight over who got to read the 4 questions. And if you've been through a Seder, you know how that process can go with the kids. And my favorite question was always, why is this night different than all other nights? Unless you're celebrating a Seder tonight, I tell you, it's no different. We've got a positive, and our hearts go out to the family and the friends and our patient, and we wish them a speedy recovery. But otherwise, we want to continue doing the exact same things we've been doing. If there are people out there who thought that COVID-19 coronavirus would not break into our bubble of Yellow Springs, then you probably thought Tulsi Gabbard was going to become president of the United States. What we need to do is to continue doing what we've been doing. If you watch Dr. Acton today and the governor, the curve is flattening. We are doing a great job in Ohio. We need to continue doing that. Don't think that we can stop. So it's important that we continue to stay home, wash our hands for at least 20 seconds or as long as it takes you to sing the ABC song. And if you're not sure how long that is, I'm sure Lisa could do a sing along for us. Cover your coughs and sneezes, maintain social distance, and wear a mask when you go outside. I am, my guys are. You should be doing it. If you're working customer service in an essential business, good Lord, you should be wearing a mask to protect yourself and others as well. If you're 70 and above, oh yeah, people, wear a mask. There's something like 9 million people in Yellow Springs who are actually sewing masks even as we speak. So I'm sure you can get one. So please do so. It's very important. As always, we want to tell you from the fire department, we're here. Call us if you need us. Come, call us, talk to us. Be safe, be kind, be hopeful. Call us if you need us. And of course, as my great grandmother used to say in her amazingly strong Russian accent at this time of year, Gut Yontif, which is Yiddish. Back to you, Josue.
Colin, thank you so much. And now we will hear from Police Chief Brian Carlson. Chief.
Thank you, Josue. Chief Altman, you're always a hard act to follow. Thank you for that. It's always, I always look forward to what you're going to say. Good evening, everyone. I'm just going to start real quick by reminding everyone to consider Governor DeWine's original message when he declared the stay-at-home order. The most patriotic thing that we can do at this time is to stay home. If you have kids and they're out of the house, they are increasing the risks to all. So please consider that. We have a lot of youth that are gathering and about the village frequently. So we're working with them, trying to remind them of the safety that they need to consider. But parents could help us with that as well. I have another topic I wanted to talk about. I know it's been a little controversial, but we have decided collaboratively that we're going to close the public restrooms at the train station until further notice due to the virus. It's difficult because we want to balance between our beautiful message in Yellow Springs of welcoming to all and always with the conflicting message of maybe just not at this time. Please stay home. After discussions with the Public Health Department, Miami Township Fire and Rescue Chief Altman, Village Manager Josue, DPW Director Johnny Burns, and Council, we've decided for the safety of all to close the restrooms on the bike path. There is proper signage everywhere. Thank you, Karen Wintrow, for helping with that. I placed those in as many visible spots as I could for bicyclists. I will tell you the other public restrooms in surrounding jurisdictions are already closed as well. The governor touched on one issue today regarding child abuse and neglect cases, and I want to pass a number out. It will be the direct number to Greene County Children's Services. I used the 855 number the governor gave, but it simply prompts you to spell the county you're in, and then it forwards you to that particular Children's Service Bureau. So the number is 937-562-6600. Again, it's 562-6600. Just call if you need to report child abuse or neglect. They will forward you to Greene County Children's Services. They will contact us and we will work with you from there. The last thing for me is a special thanks to all the essential workers in Yellow Springs at the stores, the shops, the restaurants providing carryout, Tom's Market, Dollar General. They're working tirelessly to be able to provide the goods and services for all of us. And I just want to do a special thank you to them. That's it from the police department tonight. Everyone stay safe. Never hesitate to call us for any questions or anything you may need. Josue, back to you.
Thank you, Chief. Also joining us tonight is Kirsten Beam with Greene County Public Health. Kirsten, thank you for joining us.
Mute. There we go. Hi, can you hear me? Yeah, okay, great, thank you. So at Greene County Public Health, yes, we'd like to reiterate the message that the village has already been sending out, that although there is a confirmed positive now living in the village of Yellow Springs, we do assume that there have been cases and there is community spread in Yellow Springs. So all of the messages that Chief Carlson and Mr. Altman have been saying, those are absolutely solid messages, and we encourage you to do the same things. Continue washing hands, that's important. Avoid touching your face, wearing a mask, especially if you're in a crowded place where you can't maintain that 6 feet of distancing for social distances. And if you don't have a physician, but you are experiencing symptoms and would like to speak with a doctor, you can call Cedarville Family Physicians at 937-766-2611. The community physicians of Yellow Springs have also agreed to take new clients at this time, and their number is 937-767-7291. Soin Family Practice at 937-558-3900, or Primary Health Solutions at 937-535-5060. Those are practices that have doctors that will see people usually via telehealth. Just because of the current outbreak of COVID-19, if you do have symptoms and would like to speak with a doctor. And again, the symptoms to watch out for are fever, cough, shortness of breath, and you should seek medical attention immediately if you're having trouble breathing or persistent pain in your chest, any new confusion or inability to arouse, or any bluish lips or face, anything like that, you should seek emergency medical attention and go to the nearest ER.
Kirsten, thank you so much.
You're welcome.
And we will now hear from Mayor Pam. Mayor?
Thank you, Josue. We have mentioned voting in the primary at some of our earlier town meetings, virtual town meetings, and this is another reminder on the importance of exercising your right to vote. Today is Wednesday, April 8th, and the primary is scheduled for April 28th, 8/28. That means we have approximately 20 days, 19 by the close of business today, for you to get your ballot and make your vote if you have not already. Now, if you have already voted early at the Xenia Board of Elections or by absentee voting, great, you're done. But if you were like I was and you wanted to wait and go to our Antioch Midwest and vote here in person on election day, and then you got caught up in all that confusion, you still have time to get your ballot in. Many of you have. But here is, I want to show you some resources in just a moment. At this point, you're on a tight timeline, but you still have time to get your ballot, return it, and be counted. And I've provided you with 3 of the most helpful resources that I have found. Could I have slide 1, please, Philip? The most helpful resource I found for getting you through the election is actually an article that appeared on the last issue of the Yellow Springs News, April 4th, down, and you're seeing this on a slide if you're at home on YouTube or perhaps channel 5. But down in the lower left-hand corner was an article in the Yellow Springs News entitled Ohio Moves to Mail-in Voting. That will walk you through every step of applying to get your ballot sent to your home. 3 easy steps for that. You can print one out on your computer. You can have one sent to you by filling out a form on your computer. You can call the Board of Elections, Greene County on Ledbetter Road. They're open by telephone from 8 in the morning until 4:30 in the afternoon, Monday through Friday. So they will send you one as well. Or you can make your own ballot request by putting your name, birthday, address, last 4 of your social or your driver's license, and a couple other things on a sheet of paper. verifying that it's you and actually sending that in. That will count this time. But here is the second most valuable resource. So Philip, second slide, please. And what you're looking at now is from our Secretary of State LaRose's website, guiding us through some of the different resources you can use for this election. This is the voteohio.gov website. Going to this website, hopefully you're looking at the helpful blue buttons on that slide, and you can see there's one there for requesting your ballot, easy peasy to fill out. There's my favorite was the voting tracker. There's actually a button there that you can push and put your name in there, last name, first name, and it will tell you when they send out your absentee ballot, and they will tell you when they get it back. So I found that to be a very useful tool. Your third slide, Philip, is actually the absentee ballot itself. And the reason I wanted you to look at this slide is because I feel this copy that has being circulated is very helpful in that it answers one of the questions I've been getting over and over, which is, oh my gosh, I put the wrong date. I put April 28th or I put June 2nd. Well, so my ballot's not going to be counted. No worries. Regardless of the date you put, your ballot will be counted. What they would like you to put is March 17th, 2020, because it was for the March 17th primary. However, if you were like me and put your request for the ballot in the mail the next day, it came 4 days later, a week later maybe, and I put down June 2nd, because at that point the election was supposed to be June 2nd. Turned around, put my ballot request back in the mail. Well, don't worry, June 2nd and April 28th are also being counted. So that application slide will walk you through, pay very close attention to how you fill it out. So with that in mind, my final reminder for you is that they are also accepting job applications. There are some jobs behind the scenes and on the day of and tracking things in. The Board of Elections is trying to hire more folks at $10 per hour. So if you call the Greene County Board of Elections, it's on the handy resource site at Vote Ohio. Frankly, I like that site better than the Greene County Board of Elections site, but you didn't hear that from me. Get their number, give them a call, $10 an hour, you may be hired. So with that in mind, I again suggest you consult the resource in the newspaper. Go to voteohio.gov. All your questions will be answered, and you too can say, yes, I voted in the primary. Thank you. Back to you, Josue.
Thank you so much, Mayor Pam. We have one additional reminder. If you are looking to apply for unemployment benefits, we know there's a capacity challenge on the website. We encourage you to keep trying the system. There's some lag, there's a capacity issue, but keep trying until you're able to get your application in. The state is aware of this technology challenge that they're having. Their system is just overwhelmed with how many requests they're getting. So be patient and continue to try to submit your application. Now, one point to note is that they will continue to honor the effective eligibility date. So it doesn't matter when you put it in, they'll honor when the date of your eligibility. So keep trying. All right, we will now open the floor for questions. Philip, do we have questions? We have one statement. Okay, we have a statement that's come in. Folks wants us to share this. People should be aware that there is a voter organization sending out absentee ballot applications form with a party of Republican pre-filled in. So please read all of the documents carefully. Okay, that is the statement. I think any document that you're looking to sign, you should be fully aware of what you're signing or filling out. So That goes with not just the ballots, but also any solicitations that you receive. We've seen several scams taking place. Folks being contacted via phone to provide personal information. We encourage you that you should trust a source that you're, or the organization that's reaching out to you and who you're handing over your information. Likewise, with any documents, make sure you read the document and understand what you're signing. If you don't understand it, don't sign it. Any additional questions, Philip? Okay, we have, this question is for Chief Altman and Police Chief Carlson. Waiting for the question to come through.
Ah.
It's going to be a long question. All right. Are the first responders that were exposed to the COVID positive patients still in rotation?
Yes, they are our guys. Because of the information that was taken by the 911 dispatchers and that was given by the patient, he was very forthcoming with his diagnosis. So before our crew entered his house, they had N95 masks, gloves, isolation gowns, safety glasses, and face shields all in place to make sure that they were safe. And they maintained that all the way through the transport to Soin Medical Center. So following both our guidelines and CDC guidelines, there was no exposure or significant exposure. So they're all still on duty. They've completed the necessary paperwork we have to do, so that if something does come up, then we know what to, how to track that and everything. But they were well trained and they followed their training very well and protected themselves.
From the police department, the officers remained in vehicles. Our protocol now is, unless requested by the medics, we're going to remain on site, but in our vehicles, or if protocol dictates that we enter the home first, then of course we will. But on that particular call, officers remained in the vehicles.
Thank you, Chiefs. This is a follow-up question. Are there measures being taken to observe those responders for symptoms?
Yes. We have a very detailed procedure that our guys are trained in and that we observe anytime. Our guys are, we have 3 different levels of protection based on the call type. So regardless of COVID-19, any call, if it's just a stub toe, the guys will show up with surgical masks and safety glasses on and gloves. And it goes from there. Any kind of a potential exposure, they complete forms, and then we do surveillance on every shift. So crews take their temperatures and answer a series of questions at the beginning and the end of their shift, so that we can keep track and know what's going on. Anyone who's got a temperature above 104 or answers some of the screening questions in the positive, they're sent off to back home, and contact is made with our Department of Physicians and Occupational Health, and it goes from there. So far, we haven't had any significant exposures, and our guys have been very safe, which is good.
Police Chief.
Sorry about that. We are following the guidelines of Public Health Department. We do have one police employee. It's not an officer, but they had a minor fever. We went ahead and sent them home for the remainder of the week. He's doing great, and it wasn't this virus, but we're just taking those precautionary measures day by day. One advantage, I guess, if you're looking at the positive on having a small department, is we're in constant contact with everyone. So that's been good. We're also organizing with officers a 7 a.m. workout, and that's been a big success. And I owe a debt of gratitude to Terry Holden for allowing us to use the facility, and we're diligently cleaning that. But everybody's doing fine right now. The PD's in good shape. Thanks, Josue.
Hey, Josue.
Yes,
If I
Chief.
could just put something completely unrelated, just so everyone knows, the National Weather Service has just issued a tornado watch, just a watch, for Greene County from now until 2 a.m. So just stay on your toes, keep your ears open, watch media, listen for the sirens. If you hear the sirens, take shelter. But hopefully we'll make it through without anything happening.
Yes, thank you, Colin, for that reminder. I know the storm last night was quite the storm at 4 a.m. So we have another question, two questions that have come in. This is for our first responding officers. If the first responders were to develop COVID at a future time, would they be covered under duty policies?
Yes. Yeah. I mean, they're covered. The assumption is that if a firefighter EMT develops COVID-19 during this time, it's an occupational exposure. I've been on several conference calls with the Director of Public Safety and the Governor's Office, working with the Bureau of Workers' Comp to make sure that police officers, firefighters, EMTs, paramedics, doctors, nurses, all the frontline first response and medical personnel will have appropriate coverage, workplace coverage, in the event of an exposure that develops into a virus, the disease.
Thank you, Colin. And I would expand that the recently passed legislation at the federal level, the Emergency Family Medical Leave Act, allows for extended leave for workers should they become exposed, or just a relative becoming exposed and they have to take additional precautions. So, next question. What are the thresholds will first responders be eligible for testing if they have been exposed to a patient? This question may be for Kristen or Colin. I understand that the first responders have been elevated in different category and priority for testing.
Yes. If one of our police officers, EMTs or paramedics have a significant exposure, develop symptoms, they are now considered as priority test personnel. So the tests are conducted by ODH at their lab in Columbus, typically with a 24-hour turnaround time, which is very good because a lot of people have been experiencing some of the private testing, which can take up to 7 days in some places. So we work hand in hand with public health on that, and they get the samples up to Columbus to ODH, and we go from there. For our department, we've had no exposures as of yet, and we hope not to.
Likewise, for our department, we're not aware of exposures, but we're taking all necessary precautions as if we have been exposed, but we're not aware of any direct exposures. We have another question. What is being done to manage and educate people and groups of people who are out and about? I think you've seen several efforts. Brian Carlson, you want to jump in?
Yes, we're following the governor's request, not to be the police state, so to speak, but we are engaging people. I'm sure you've noticed that all the officers, when we're out of the vehicle, we have masks, we're wearing gloves. We're politely reminding folks about distance, and this is some of the things that the governor said as well. We have had a few, I guess, altercations, if you will, out in public between folks on the bike path. I think I've mentioned it before. They're talking, they're not happy with how maybe another family is keeping themselves safe, but we're mediating most of those. And, people are definitely a little more on edge right now. But the biggest thing that we're seeing, folks, are the youth of the community traveling in small groups. And anything that families, parents, mentors, peers, pastors, anything that we can get the message out to educate the youth of the importance of following these guidelines would be very helpful for us. Thanks, Josue.
And what are we doing about individuals who are out and about without masks? Any education efforts?
Individuals, no. So it's not an order, unfortunately. So we're kind of timidly reminding folks, that it might be a better idea to wear a mask, but we're finding that can be insulting to some folks. So if there's a combination of, people not wearing masks, they're not abiding by the social distancing model, and they're in groups more, we're working with maybe 4 or 5 or more in close proximity, then we think that warrants our intervening. When we see, a resident, a couple in town walking without masks, I don't feel that, the officers need to engage at that point.
Thank you, Chief. And I'm doing my part by leading by example. I have this really cool mask, double-sided, real cool patterns. How could you not want to wear one of these? Thank you to Katie, one of the wonderful 20+ sewers in the community who sewed this for me. All right, we have another question. Is the village disinfecting or cleaning public surfaces such as benches, railings, playground equipment? If so, which areas and surfaces and generals? I'll start the response to this, and then anyone who feels they want to jump in can. We have closed down our playgrounds. So we're not allowing anyone to use the playground, the kids' playgrounds. The schools have closed down their playgrounds, and so no one should be using those. The public restroom has been closed, and now that's an action that we took today. It took us a while to get there. We understand that some members of the community rely on that bathroom, but it's a recommendation by public health that we close public restrooms because they are high-touch areas and sites to spread the virus. So we heed that recommendation. Police Chief Carlson talked about earlier about the decision-making process. We try to get a very collaborative effort and a group decision on this, and it was the best action to take, and we've taken that. Now, regarding public spaces, we've put out hand sanitizing stations throughout the downtown area. We had a station located at the train station, and we're relocating that to an area where the general public would have better use for it, particularly around an essential business that's operating. So we'll move that. In terms of cleaning services, we have not we're not going around town cleaning benches. So nothing to report there. Any of my colleagues want to add? Okay.
Josue, I'll jump in real quick. As always, the officers are cleaning up spaces with litter and things that we find, debris. I know DPW has been real busy from the storm last night. I think we had a couple of trees down and some power outages. But, cleaning public spaces like benches, railings, the skate park, areas like that, we don't find that is proactive at this point, hoping that the community and visitors will, again, abide by the governor's wishes and do the best they can to stay home.
Josue, it's been my observation that our villagers are doing a wonderful job of not only distancing, but they have their own personal hygienic products with them, whether it's a commercial hand sanitizer or wipes or something they've concocted at home. So I believe that goes back to something you and Chief Collins said at the beginning of this broadcast, which is always assume that virus is around you and take the precautions that you have been warned about from the get-go and pay close attention. And when all else is in doubt, we're almost there, but just follow the words of Dr. Amy. Y'all, we got to flatten that curve, okay? So she's on there every day giving us tips and things to do. So let's just keep doing it. We're doing well here in the village.
Thank you so much, Mayor. And I think that's it for, oh, we have 2 more questions. And these will be the last 2 questions, and then we'll close out this town hall. Have you reminded your first responders to update their family notification systems if something were to happen to them? And follow up to that is, what do those notification systems look like? Chiefs?
I mean, our guys and gals keep their, we keep the information as up to date as we can. Sometimes we have to remind them to tell us. We're a small department, so it's much like the police department. So it's pretty easy for myself, for the assistant chief. We pretty much know everyone's business, and between the 2 of us, so we're able to say, "Hey, didn't you move recently?" and that type of stuff, and keep everyone up on that. Everyone's also trained. I mean, they've got to have the responsibility to talk to their families, their loved ones, whoever they may live with, and make them aware of what's going on. So yeah, I mean, we do our best to keep everything up to date at Fire Rescue.
Yes, ditto. I don't have much to add. Thank you.
All right, we have one more announcement. If you don't already know, I'm a fan of Lynn Harmon's exercise classes. And now you 2 have an opportunity to check out her exercise routine. We're going to be running her exercise program and classes every Tuesday and Thursday at 11 a.m. on our Channel 5. Now, if you miss Channel 5 programming, you need not worry. It will be available on our YouTube channel, so you can watch it at any time and play it as often as you like. So, exercise classes with Lynn Harmon, Tuesdays and Thursdays at 11 a.m. on Channel 5, and you can catch her show anytime on YouTube. And with that, I'm going to close out this virtual town hall. I want to thank you for joining us again for a virtual town hall. I want to thank our presenters for all the work that they're doing and for joining us again tonight. I want to thank the state team, Governor DeWine, Dr. Amy Acton, and all others who are working hard to make sure that Ohio will pull through this and will pull through this together, minimize the impact. I also want to thank our wonderful community leaders who are doing a great job of making sure that we are building a resilient, robust safety net, that no one falls through the cracks. With that, I want to wish you a good night. Stay safe. Thank you.